I trained in Australia to do my internal medicine and cardiology training, and subsequently I wanted to subspecialize in cardiovascular imaging. And I really wanted to come to the Cleveland Clinic because it's world-renowned and it also has really high patient volumes, allowing us to practice cardiovascular imaging to the highest standards. I really enjoy working with complex cardiovascular conditions such as valvular heart disease, and cardiac imaging lends itself to it because a lot of the patients we see have complex issues and rely heavily on cardiac imaging to diagnose and subsequently manage their problems. I found this aspect particularly interesting. It involves a variety of imaging modalities like echocardiography, cardiac CT, cardiac MRI. On the first visit, I tend to have a quite detailed chat with the patient, and I find out exactly what their symptoms are and how their lives are affected by the medical condition. We would also do a thorough physical examination and go through the investigations in detail. And following that, we tailor an individualized management plan based on the patient's goals of care and philosophy in life. Sometimes it could include just monitoring or surveillance. Sometimes it could involve changing their medications or medical therapy. And on occasion, we'd have to refer them for valvular surgery or transcatheter procedures. When I can make my patients feel better, typically it's not when you see them the first time, but it's on subsequent visits. After they've had their surgery or after we've treated their medical conditions with medications, and they come and tell you that they feel so much better. And to me, that's really, really rewarding.